Chapter 2, the Central Nervous System. Question 1. Parasympathetic preganglionic axons leave the CNS with the A. Cervical spinal nerves, B. Thoracic spinal nerves, C. Lumbar spinal nerves, D. Sacral spinal nerves. Correct answer is D. Sacral spinal nerves. Parasympathetic axons exit the central nervous system only with sacral spinal nerves and 4 of the cranial nerves. Sympathetic preganglionic axons exit the CNS only with the thoracic and upper lumbar spinal nerves. Question 2. Where are the vital centers located in the brainstem? A. Midbrain, B. Pons, C. Medulla oblongata, D. Cerebellum. Correct answer is C. Medulla oblongata. The respiratory and cardiovascular centers are located in the medulla of the brainstem. They may be compromised when intracranial pressure is raised. Question 3. Noradrenaline is the neurotransmitter between which of the two structures below? A. Parasympathetic pre- and postganglionic neurons, B. Sympathetic pre- and postganglionic neurons, C. Parasympathetic postganglionic neurons and target organs, D. Sympathetic postganglionic neurons and target organs. Correct answer is D. Sympathetic postganglionic neurons and target organs. Acetylcholine is the neurotransmitter used to transmit impulses from pre- to postganglionic neurons in both the sympathetic and parasympathetic nervous systems. It is also used between parasympathetic postganglionic neurons and their target organs. Noradrenaline is only used between sympathetic postganglionic neurons and their targets. Question 4. A patient cuts a peripheral motor nerve in their wrist when they fall through a plate glass window. If the nerve does not regenerate, after about 6 months the muscles it normally innervates will show signs of which of the 4 options below? A. Spastic paralysis, B. Flaccid paralysis, C. Atrophy, D. Contracture. Correct answer is C. Atrophy. The immediate consequence of peripheral, lower, motor nerve injury is flaccid paralysis. Atrophy will become noticeable after about 6 months and contracture after about a year. Spastic paralysis is a consequence of damage or disease affecting central, upper, motor neurons. Question 5. Which one of the following is brought about by activation of sympathetic nerves? A. Contraction of bronchial smooth muscle, B. Dilation of the pupil of the eye, C. Increase in intestinal secretion, D. Decrease in heart rate. Correct answer is B. Dilation of the pupil of the eye. Sympathetic stimulation is preparing the body for actions of flight or fight. It would dilate bronchial muscle to allow more air into the lungs, decrease intestinal secretion to minimize use of valuable energy in non-essential functions, and increase heart rate to distribute blood to the tissues, particularly skeletal muscles, more rapidly. The pupils will dilate, a reaction seen in people receiving a shock of some sort. Question 6. The dorsal roots of all spinal nerves contain: A. Sensory neuronal processes, B. Sensory and autonomic neuronal processes, C. Motor neuronal processes, D. Motor and autonomic neuronal processes. Correct answer is A. Sensory neuronal processes. Dorsal roots only contain sensory neuronal processes of spinal nerves. All ventral roots contain motor processes, and the thoracic, lumbar, and sacral spinal nerves also autonomic nerve processes.